Why We Need Healthcare Reform by Brett Igo for Intro to Authoring Tools with Dr. Schamberg. In the Declaration of Independence, it states that we the people have the right to life, liberty, and the pursuit of happiness. One of the rights that all human beings, including Americans, should have is the right to life. That seems so obvious that it shouldn't even have to be written down. If someone is sick or dying, they should be able to get help. But for some reason, an idea so basic and fundamental is very complicated. Healthcare has become a luxury instead of a human right. In this country, healthcare is big business, and with all big businesses, the ultimate goal is profit. Profit keeps investors happy. Executives get bonuses and raises based on how much profit their company earns. No wonder why revenue is healthcare's only concern. There are many ways insurance companies can increase profit. One way is to deny care to people with pre-existing conditions. Why insure someone that is already sick if your goal is to maximize profit? Even if someone has insurance, this doesn't guarantee that the insurance company will pay all medical expenses. Some insurance companies look for loopholes so they don't have to incur large expenses. A government-run healthcare system would not be concerned with profit. Their only concern would be caring for all people. The government already runs a very successful medical program called Medicare. It also runs other very important services in our lives. Our taxes pay for police, fire, military, postal, and educational services. It isn't like our present medical system is working very well. There are approximately 45 million people in this country without health care, and 10 million of them are children. Although the U.S. spends the highest portion of their gross domestic product on their medical system, the World Health Organization ranks the United States 37th in the world. France is ranked number 1 on the survey, and they have a government-run health program that is much less costly to their people. The United States is ranked 23rd in infant mortality. The infant mortality rate in the United States per 1,000 babies is 6.9. Sweden's rate is half of ours with 3.4 deaths per 1,000 babies. A recent study found that 62% of all bankruptcies filed in 2007 were linked to medical expenses. Of those who filed for bankruptcy, nearly 80% had health insurance. People shouldn't have to lose everything so they can have essential medical treatment. Now I know a single-payer government-run healthcare system is unrealistic at this point, but we need the government more involved in healthcare to work side by side with the medical industry. Republicans and Democrats should be working together to pass a new medical reform plan. The bottom line is, when it comes to a person's health, money should not even be a factor. The rich, poor, and everyone in between should have sufficient medical insurance. The system we have now in place promotes profit, not healthy citizens. The United States spends the most in the world for our medical system, and we are definitely not getting what we paid for. Now is the time for change.